When you hear about TikTok, you think of funny videos. Well, now there's a new trend where teens are using it to self-diagnose mental disorders. And joining me now to help break down this disturbing, growing trend is psychiatrist, my friend and colleague, Dr. Dominic Sportelli. Dr. Sportelli, what's going on?
Dr. Orden, so great to be with you on this one. This is an important one. And I have to start out, listen, I got to start out by saying congrats to TikTok. This is a good thing because as a behavioral health specialist, raising awareness for mental health is awesome. However, it's a double-edged sword and we are seeing a really big problem. So the problem here is that kids are making these videos. They're making videos on TikTok about serious, rare mental health disorders, and they're sharing the symptoms. But the list of symptoms that they're sharing are mostly vague, they're non-specific, and they're leaving out so much important diagnostic info. So kids are reading this now, and they see these vague symptoms, like a couple of bullet symptoms, and they go, oh my God, I must have whatever, fill in the blank, bipolar, ADHD, dissociative identity disorder. But guys, this is far, far from an accurate diagnosis. And the biggest thing is whenever you're diagnosing somebody, you have to say to yourself, it's not better explained by something else. And only a trained physician or psychologist or behavioral health specialist can know what it's not, right? I think that's the most important thing. So again, the awareness is good. The self-diagnosis, the misdiagnosis, and even, God forbid, self-treatment is bad. But I'm going to add one more thing to this, Doc. If you read this stuff on TikTok, now you think that you're some kind of specialist in psych. You might diagnose other people.
Well, that's
you might tell your friends.
Oh,
I
yeah,
know you might tell your friends. Oh, you sound like you have bipolar.
They gain this knowledge, and I'm convinced that I have this, and I read about the symptoms, and I think you have this. And Dominic, I need to ask you, are you seeing more patients coming in and telling you what their diagnosis is?
Oh, absolutely 100%. Literally just this morning, I had a patient in the hospital and she said, this is exactly how she said it. Oh, I'm totally bipolar. And, of course I take that with a grain of salt. And I say, why do you say that? Oh, my friends and family tell me that I have mood swings, so I'm bipolar. Well, that's a huge misconception. It's a perfect example. Just because you have mood swings does not mean you have bipolar. Bipolar is a very serious illness with a very distinct time frame, a very specific symptom list, and again, ruling out a lot of other things. But the important point, I think, here is that there's a reason that kids and patients are self-diagnosing. And I think it's because they don't feel like they're listened to. I feel like they don't feel understood. So when she says this to me, the most important point to me is to listen to her and then help her understand why I don't think that is, and really, really educate her as to why I don't think she has bipolar disorder.
It's such a great example.